Hey there, I'm Dr. Jeff Fenyves with the Center for Digestive Wellness and TriCities Gastroenterology. Thanks for paying us a visit. I started the practice as a co-founder about 12 years ago, but I've been in practice in the Tri-Cities for about 22 years now. The major advantage that we have of doing the procedures here is the patient doesn't have to go to a very crowded hospital, and the cost basis is a whole lot cheaper here. So we specialize in doing just GI procedures here, such as colonoscopy and upper endoscopies where we look at the stomach. And the patients can do it in a very comfortable outpatient setting without having to go to a big hospital and incur big hospital costs. The other advantage is our patients can park right here in our parking lot and walk right through the front door. They don't have to walk across the street or through complex buildings. Doing this also means that they're in and out of our facility a lot faster. They can typically have a colonoscopy and then be home in less than 2 hours. You can't do that at a hospital. It's just too busy. So it translates into lower cost, lower time spent, and more comfort. Since this is all we do, we specialize in gastroenterology only, don't do other procedures, we do them very, very well. And we do them as well as you can get done almost anywhere in the country. In fact, our adenoma detection rate, or the rate at which we detect precancerous polyps, is as high as almost anywhere in the country. We do about 4,000 procedures a year, and this allows us to do them very well. We also have our staff that specialize in helping us do these procedures. They don't do other surgeries, they don't do other procedures, they just help us do GI procedures. So let's talk a little bit about why you should care about colonoscopy and why we do colonoscopy. It's really because colon cancer is the #2 cancer killer in the United States. About 60,000 people die every year from colon cancer. That's surpassed only by lung cancer. And the difference is colon cancer is largely preventable. Most of the time it takes 10 to 30 years for somebody to get cancer from a polyp that's growing very silently in their colon. By age 50, about 25% of women and maybe 35% of men are already growing precancerous polyps. They just don't know it. So what do we do here that makes colonoscopy a little bit more comfortable for you? We've tried to focus on things that we can do to maximize patient comfort, but also maximize the chances of finding and removing precancerous polyps so that if you have your colonoscopy here, you don't get colon cancer. That's the whole goal. A couple things that we do. Number one, anesthesia. We use propofol anesthesia here. What's that about? Well, that's a type of anesthesia that makes you extremely comfortable. You're still breathing on your own, but you're relaxed, and you wake up feeling very refreshed and not hungover and never nauseated. So that anesthesia actually makes the colonoscopy of better quality, we believe. The other advantage that we have here is we use carbon dioxide to inflate your colon. When you've gone through the trouble of decompressing your colon and emptying yourself out, you have to put something in order to see. And typically that's room air. The problem with room air is it makes you gassy and makes you crampy. We don't use room air, we use carbon dioxide. And your body absorbs that and you breathe it out. So you wake up and there's no gas, there's no distension, and there's no tooting. You'll be glad to know. Well, now that we've talked about the important things like preventing colon cancer, let's talk a little bit about what's on your mind. What about the prep? How hard is that going to be to get ready for colonoscopy? Well, first realize that the prep is the most important part of the whole thing. The prep really determines, for the largest part, the quality of the colonoscopy that you're going to have. Because everything else we're going to do technologically and experience-wise to make this a great colonoscopy. So the prep has to be good in order for you to get a good quality colonoscopy and prevent colon cancer. So, is it easy now? No, I can't tell you that. But it's a lot easier than it used to be. We have a variety of preps, some of which you'll consider easy if you've done the other preps, some of which aren't quite as easy. But we will do our best to make sure that you have a good quality colonoscopy with a good prep and that it's as tolerable as possible. Once you're here, the tough part's over, you can relax. Coming here makes this a lot easier. We'll do everything we can to take care of you just like we would want our family members taken care of.